Hi, and welcome to your training on guidelines for observing and reporting. First, we're going to talk about reporting medication errors. So any missed medication, whether it's daily or PRN, this is as needed, requires proper reporting. Reporting will be required for any medication error that reaches the individual. This does not include refusals, contamination, or documentation errors. The following guidelines are to be followed. If an error occurred during daytime work hours, follow your chain of command. So notify your team leader, who will then notify the professional manager, and from there, the nurse. Complete a medication error event report and send to the office for data entry no later than the next business day. If the error occurred after daytime office hours, call after hours staff on call. Complete a medication error event report and send to the office for data entry no later than the next business days. What needs to be reported immediately? When to call 911. So I'm going to go over several things that need to be reported immediately. When to call 911. So the person has a serious illness or injury. The person does not respond to voice or touch. The person has chest discomfort. Maybe they show signs of a stroke. They're having breathing problems, severe injury or pain. The person has a seizure and doesn't have a diagnosis or a history of seizures. The person suddenly can't move part of their body. The person received an electrical shock. The person has been exposed to poison. The person tries to commit suicide and there are significant injuries that require medical attention beyond first aid. The person is assaulted regardless of their condition. In the event of a medical emergency listed above, 911 should be called immediately. Follow up the incident is to be documented in staff notes within 24 hours and should include where it happened, the health and emotional well-being of the person, and staff notes should include who was contacted and their response. But when in doubt, call 911. If unconscious, immediately call 911 before anyone else. That's very important. Anything that is not normal, report to your supervisor, the nurse, or doctor. Now let's move on to poison control. If a person is suspected of ingesting something toxic, notify poison control immediately. Follow directions given, then follow your chain of command. If during normal business hours, notify your team leader, they will get in touch with your PM. If after hours, notify on call after the poison control has been notified for further instructions. Now, when to call the RN consultant. You want to follow your chain of command. You would notify your team leader or on call if after hours. Then from there, they would notify the RN for further orders. And this needs to occur during a significant change in medical or behavioral health of an individual. The individual has experienced an unexpected decline in mental or physical health that has caused a change in their ability to meet their basic needs of living, such as cooking, toileting, housekeeping, hygiene, etc. Now let's talk about medical emergencies. When an individual has a significant change in health or mental status, follow your chain of command to notify the RN consultant. It is the RN consultant's role to assess the individual's current state of health, including physical and mental. The RN will then Make a competent decision on what actions need to be taken next. Depending on what the medical emergency is, you'll want to be prepared to give information in regards to the person's appearance, possibly their energy level, their appetite, symptoms, what are they, how long have they been occurring, their sleep patterns, bowel movements, and vital signs. So their blood pressure, temp, pulse, and respiration. Steps to take for specific medical emergencies. Individuals with a head injury must be taken to the emergency room as soon as the injury occurs, or call the ambulance. In such cases, follow your chain of command with the status of the person's health and diagnosis, and whether the person will be released, admitted to the hospital, or moved to a different facility. If the person supported sustains an injury and treatment requires attention beyond first aid, the person should be taken to the doctor, urgent care facility, or hospital emergency room, either by staff or the ambulance if needed. Again, you're going to follow your chain of command and take the same steps as before. Give an update on the status of the person's health or diagnosis, whether they'll be released, admitted to the hospital, or transferred somewhere else. If there is a medical emergency and the person supported is unresponsive and or there is no pulse, staff are to immediately call 911. Do not call multiple people seeking permission, and start chest compressions immediately after calling 911. Do not call people seeking permission or direction. Follow your steps for CPR. The 911 operator is capable of walking you through the steps of CPR if needed. But try not to panic during an emergency, but be prepared and know what to do before. Thank you.